Welcome to Community News. I'm Lori Nussbaum, and today my guest is Yasniel Valdes from Hydrology Wellness. He's a nurse practitioner. And Yas, welcome, and thank you for being here. So tell us a little bit about Hydrology Wellness, but first, before we get started, tell us about you and how you got there.
Thank you, Lori. It's an honor to be here. Yes, I'm a nurse practitioner at Hydraology Wellness. And a little bit about myself, I'm Cuban, so I'm an immigrant. I came here when I was around 15. Literally crossed the border swimming with my brother and my mom. Kind of carried my mom over with my brother
Wow.
through the Mexico border and got to Texas. That's how I started my American dream. I initially started my career as a firefighter, a paramedic. Did that for 2 years and then went in as a nurse and then did nursing for 12 years, 13, ER and trauma for UM, University of Miami Hospital. Then after that, I became a practitioner. I've been practicing as a provider for 5 years. Now I currently work at Hydrology, which is a wellness center that kind of has everything in one place. We have, wellness, health, and beauty all in one. And how I started this journey is I treated a lot of patients acutely, so with emergency, real life scenarios. And then I started taking upon myself things that I can do to prevent or create longevity for myself. And that's the interest of this career path that I have now. And that's where I find myself now in hydrology. And I love what I do now.
Okay, well, first, let's just go back a little bit. You came here from Cuba. You read about this, and that's amazing. So you were 15 years old. You had your mother, other family members?
And my brother.
And your brother, and they're all here now.
Yes, they're all here.
And you were in school, and then wow, and then you went to school here, and you kept going and look at you now.
Yes,
that's amazing.
Yeah, to this day, I'm very proud of myself and thankful to my family and all friends and family that made this happen for me too. The journey of crossing over the border, it was challenging, and my mom knew I was taking a risk, but we came from a communist country and we wanted a lot of freedom. So I think that this country has provided that for us, and I'm very, very thankful.
What a beautiful story, really. Okay, so you went to, you said, or I don't know if you mentioned this, you went to University of Miami?
Correct. I'm a graduate from UM.
Good for you. And then you went and worked at University of Miami. So tell us a little bit about that background.
Yeah, I actually, coming out of high school, my first job was UM. I did clinical coordinator and for surgical, for the surgical center there. So that was my first job, and I kind of stayed around and became a paramedic, and then I worked for UM ambulance. And then I became a nurse, and then I worked for the emergency room. And then 1 year into being in the emergency room, I became a charge nurse for about 11 years to 12. And then at the same time, I worked right in front of Jackson, where the trauma center level 1 as a resus. So resuscitating, kind of like the worst cases you can find in Florida, we will receive and resuscitate and, bring back to life pretty much. That was my passion for a while. I love critical care and acute care. I always felt that I could make a big difference there. And then I took a little bit of a shift because I always been artistic too, and I didn't know how to combine both medical and the artistic side. And that's where I found preventative medicine, aesthetic medicine, and that's my specialty now, and that's my complete passion. So I get to do both.
So you got right into, went right the opposite way.
Yeah. I still treat, I think my patients more for longevity. We're trying to, what we say, catch the eggs before they fall and break, right? A lot of people think of like, oh, they become aware of their sickness when they already have it. You know, there's a lot of optimization now we can do with hormones, a lot of nutrients, vitamins that we can prevent a lot of disease,
Right.
inflammatory responses that are happening out there. So I think hydrology is the house of that, embodies, you know, medical, health,
Right.
and wellness and beauty too. Because my specialty also is beauty. So I went to Switzerland, London. That was my first studies for aesthetic treatments. And then I do a lot of that too.
Okay, so you wonderful background, amazing. So you go to hydrology. How long you've been?
For a year now.
For a
and
year.
then Hydraology has been, we're about to celebrate 1 year anniversary. We're having an amazing event coming up on June 28th. We're going to be celebrating the 1 year anniversary of Hydraology being open. So we're very proud of Hydraology. There's no place like Hydraology here in Florida.
Okay, so I'm going to ask you, what is hydrology? What is that for those of us that, you know, you mentioned you combine medicine, aesthetics. So what does that look like?
Yeah, so it's when somebody asks me about hydrology, it's kind of hard to explain in the sense of like, I think the easiest way to say is like the one-stop shop where it has it all. So I'm sure if you walk in, you can find several services that you'll be interested in. And we start with, you know, having aesthetic treatments, Sculptra, lasers, biostimulators, fillers, Botox. Then we have the health component. We have preventative cancer testing. We use Gallery, which can tell where the cell mutation is happening and the location that it's coming from. We have derma scanning, where we can scan lesions and we can determine how high the risk of the lesion is. We have ALCAS tests that test for food sensitivity. We have all those testing too, and we do lab work too. We take insurance and we are able to do advanced testing where we're looking at, you know, different markers that can utilize to optimization of your full health. We also are very lucky to, our medical director is Alexander Zuri. He's a quadruple certified, board certified surgeon, and he's my mentor too. And we do very strong work on the pre and post care of any surgery. So we do have a lot of also the medical component that we guide every patient before the surgery in a very specific and unique protocol where we are going to guide you through the surgery and then also after. So we provide massage, lymphatic massage. We have hyperbaric chambers with optimization of recovery and tissue repair. We have cryotherapy with, you know, the cold exposure, cold plunging, red light, sauna, you name it. We have it all.
So, okay.
So that's why it's really hard sometimes to explain, you know?
So, okay, like let's say I'm going in there for a regular checkup. Would I go to you? Or would I go to my regular doctor?
You can come to me because I will look at different markers that your primary care probably doesn't justify because the insurance purpose are not going to be testing you. So I look at other markers. We do lab tests and I'm able to kind of preventively treat you. All your
concerns. You don't take insurance?
We don't take insurance.
Okay.
Yeah.
So that's
only for blood work. So we do take insurance if you're doing your blood work.
So you're proactive as opposed to reactive.
Correct.
So basically, if you have various ailments, if you have you're treating the body, you're treating various things that people have.
Correct. We're looking at early symptoms or markers that could suggest in the future that you could have a problem. So why are we not targeting these issues preventively so that we can have a functional life? My goal is to get to 80s or my 90s, but functional, right? I don't want to be 80 and being stuck in the hospital. I've seen it. I did it for a while. I did 12 years of that. And that's where my passion became about more prevention and less of treatment when the disease is already present.
Do you see, because this is like the new trend. So what separates you from other facilities such as yours?
So we have all the support. We have a lot of staff. We have a medical director that obeys by the standards, the highest standards of medical care safety. And also we have a holistic way and approach to really optimize a full potential as a patient, right? We're not looking at the direct cost. We're looking at other areas that can really help you optimize. So we're looking for optimization, not replacement, optimize. Meaning, like, for example, we do a lot of hormone replacement, and I don't call it replacement so much. I call it optimization at this point because we're not targeting a number when it becomes below. You go to your primary and tells you, for example, testosterone at 200, and he says, no, that's fine. That's normal. It's supposed to happen. I'm like, why did in your 30s were higher, 600, you're more functional. We're allowing muscle build up. Testosterone is not only good for muscle, it's only very good for function of your brain, memory. So all these things are needed, and I'm able to educate the patient and what tools and power they have to optimize and prevent disease early on.
So you go, nowadays you go to your doctor, and I know that, my doctor will say to me, okay, you can, you talk to them about hormone replacement, and they're all pushing all various different things like that. So if someone comes to you, it's one stop. You can do the gynecological visit and all of those kinds of
Correct.
things.
Yeah. We want to we have everything in one place. And that's why we Dr. Zuri really did such a good job in creating a place where you don't need to go anywhere else. You need laser hair removal, we have it there. You want aesthetic treatments, we have it there. We want preventative medicines, we have it there. You want surgical post care, we have it there. You want to recover, you're an athlete, you want to recover right in front of we have all the modalities to recover better. So we can offer everything in one place.
Yeah, that's great. And if you're, like you were saying, if you're a sports person and you're an athlete, tell us, what is cryotherapy, or the how do you pronounce it?
Hyperbaric, and we have cryo too. So cryo is cold exposure to think of nitrogen. We're using nitrogen as a gas to get your body cold. So it goes, we have different layers, and it goes from negative 166 to negative 220. So what that's doing, a max of 3 minutes. I personally, I do CrossFit, so I work out a lot. So I do a lot of lifting. I do a lot of, I need a lot of recovery. So we utilize cold exposure for recovery, inflammatory responses, joint issues, mental clarity. It's a natural energetic product. So you're going to feel super focused, energized in a calm manner. So cold exposure tends to do that. Now, new research shows also 12 minutes a week of cold exposure. That could be cold showers. There's a new study that said can decrease Alzheimer's and Parkinson's about 30%. Oh, really? So it is a big deal that we're we're taking a different approach to recovery in preventive medicine, and we can offer that. If you don't like to submerge in water, we have the cryo. So you are kind of dry. It's just you're gonna feel a cold sensation, and that's how we obtain the cold exposure.
What are you seeing now? Who are most of your clients? Who is that person?
So we have a little bit of everything, but I see one of the biggest three demands that we have there is hyperbaric chamber. We have NAD, which is a coenzyme that helps your cell to optimize full potential and energy. So there's studies that shows now, new research, that if you optimize your cell, that means you're doing a good job recycling the cells, helping you every type of cells in your body. So you're optimizing the potential you as a human. So it prevents everything, swelling, aging of the cell, skin quality, all these things. So it's something that we provide as IV or injections, and we have different types of membership that the patient, if is looking for longevity, we can provide that service too. And then one of the other services that we provide is hormone optimization too. Those are kind of like the top three, but then I do all the aesthetics parts too. I get a lot of Sculptura, which is a natural biostimulator. So we do a lot of other stuff too. But those are like top three. And if you want me to talk a little bit about hyperbaric, because I know not a lot
Well,
of people.
yeah, we have a few minutes, so tell us
Yeah.
a little bit
So
about that.
hyperbaric is
I hear about it with the athletes.
yeah, athletes, they
yeah.
have it in the hospital. They use it
Right.
for patients, diabetic patients that are not healing properly and they want a wound to close. But the same thing, we use it for surgical after the surgery. If you want to heal
Oh, wow.
faster, it's
Okay.
kind of like a cocoon looking. It goes into a pressurized system. You're going to feel like you're going in an airplane, and then it has 100% oxygen. So all we're doing is pushing into the cell that oxygen to go into microcirculation. So you're able to heal faster, recover faster, prepare for a race if you're an athlete. So it's hyperoxygenated state on the body.
Very interesting. Very
Yeah.
interesting. Okay, well, we have a few minutes left.
Yeah.
So, anything else that you want to share with us? You have an event coming up.
Yes.
Your 1-year anniversary.
Mm-hmm.
Tell us.
So I would like to invite everyone that hears this podcast to this event we're hosting on June 28th. It's going to be from 5 to 9 at Hydrology Wellness. Is at the Theses Hotel, where right in front of So we're gonna be celebrating the wellness center overall. We're gonna have a lot of
nice.
giveaways,
Okay.
drinks, foods, and it's just to embrace what Hydraology has done in a year, and then also to celebrate our clients. We love our clients and our staff, so celebration, it's great.
Well, thank you so much for being here. Let us know you're located at
the Theses
address.
Hotel. So that's on Dixie Highway, right in front of the University of Miami, which is 1340, I think, Dixie Highway.
Perfect.
On the Theses Hotel.
Okay. Well, thank you so much for being here today. Really appreciate it. Hope you'll come back again. And I'm going to have to give it a shot and come visit.
Yeah. Thank you, Lori. It was a pleasure to talk to you.
Thank you. Have a wonderful day.
You too.